We actually have a list of sort of some of the concepts that we thought were important to be included in mental health instruction. And, Jess, you mentioned that some health educators were already talking about some of this. I know one thing that health educators were required to speak to was the idea of substance use prevention, right? And so we at that time too felt like this was something that fit in very naturally with that conversation. I wonder if you could talk a little bit more about that and how maybe some of these concepts were being used already in the context of health. I think even just thinking about reducing risky behaviors as well, right?
Definitely. So those things were already required throughout New York State as part of the guidance document that had been implemented from the early 2000s, really. And one of the biggest challenges I think that many health educators face in New York, and I'm sure other states as well, is that we really only have 20 weeks mandated at the middle school level and then again at the high school level. And we have so many different topics that we need to cover. So, yes, thinking about mental health from the perspective of substance use prevention, something we were already including, would be a helpful way to encourage people to get this into the curriculum if they didn't already have a place for it. I know teachers in all different areas constantly struggle with the idea of how am I going to fit this in? How is it going to work with what I'm already doing? Because whenever new mandates come along, if it's supposed to be something I'm doing from scratch, and if I have to invent the wheel myself, and if it feels like one more thing, that can be really overwhelming. So the idea of putting this together with information that was already being taught and taught for now, over 20 years or more, really, I think is a helpful way to get it into the curriculum. And so that was valuable, I think, to teachers, given the mandate.
Yeah, thanks. And on the next slide, we talk a little bit more about the timeline and the implementation process. And as Jess mentioned, she was part of the advisory council. For the better part of a year or so, this advisory council convened regularly, and we looked at not only the mental health education components and content and what that should look like, but we also looked a little bit more broadly because it felt like we couldn't just talk about mental health education within the context of the curriculum without talking about things like policy, professional development. And so that became a really important part of the guidance document. And throughout that process as well, we began to think about this is something that schools are required to do. There's not a lot of resources that are available necessarily directed towards that. And so we advocated, the Mental Health Association of New York State advocated for some funding for a resource center that could help schools take the guidance document and really pull it apart, identify resources for implementation, and support schools' efforts in moving forward with that.
Yeah, and I think speaking as a health educator who was on the committee, the idea of putting together a guidance document that already mirrored documents in existence was important. And if we're talking about other states looking to replicate something similar to what we've done here, the idea of making it feel like it already fits cohesively with the existing required content was important for sure. Um, the other thing with regard to that is that you're right, it wasn't just the health educators who were going to be part of this conversation, but the idea of bringing in all of the many people who would then provide support outside of the classroom. The resource center that you mentioned is really valuable because it it really includes a lot of information for teachers. We have basic canned lessons if that's somebody's starting point. We also have resources where people can do webinars, or they can have someone come to a conference and present at a conference. So, and I know that we'll be speaking more to the resource center momentarily, but the idea of um, an educator looking at this as a resource, okay, I know where I am in my curriculum, and what do I need as a tool to help further along my process from wherever my starting point might be. I think that that's something that we've done pretty well so far, so that anyone, someone who's not covering it much at all, someone who already is but needs some additional support, or someone who's already really far along and still wants to do better, there's something in it for everyone, and I think there was value in that.
Absolutely. The other piece I think that was important in this was bringing in those community providers, that we recognized that schools didn't need to do this alone, that they were going to have some support at the community level. The Mental Health Association in New York State has a network of 26 affiliates across the state. So we understood the importance and the value of connecting with those community providers. But New York State has lots of great resources in that, in their prevention providers. And family organizations that are able to provide that kind of support. So that became a really important part of this process, was engaging the community as well. And then if you think about it from a school perspective, as we begin to identify students who might have some mental health challenges, it was important to have those providers be available and already relationships existing, so that you can build connections when you need to, for families who might need to access that support and those resources. So here we have a little bit of a snapshot from the Resource Center, but also the social emotional learning core competencies that are included in mental health education.
One of the things I'd like to highlight about the website, the Resource Center, right? I can see it from different perspectives. Being a licensed social worker, I see a professional aspect to it, different entry points. So as you log on to the website, there's different tabs. Because I imagine for a parent, how do I start the conversation that I was never given as a student? So my
Mm.
son or daughter is coming back from school. I'm like, I have to start studying up and knowing what they're talking about. They're learning terms and language and theories that I haven't learned. So I'm able to hit that tab to see, how do I join the conversation appropriately? There's a lot of pressure as a parent to be up on trends and language and music and dance, whatever the kids are into these nowadays, right? But this is something that's going to be universal and consistent. And it's also pre-vetted. The idea that I don't have to blindly go through the internet and try to find
Mm.
my own sources. I have a single point of access that I know, if I want to see what would the teacher potentially be utilizing, I can click into that tab. If I want to look at what a community partner may look at, it's very transparent and very holistic, where everybody's working together. And I think it's really, really important to move it forward.
Yeah, and I think even from thinking about that from a parent perspective, something like the social emotional learning core competencies, when we look at those, they are very relatable, whether you're a parent or a health educator or a student. Can you talk a little more about those, Jess, and how they sort of tie into mental health education?
Definitely. So, social emotional learning was also something coming through in New York State right around the same time that we were looking to create our document to be given to teachers. And so, the idea of looking at what they had created and literally creating a document that could mirror it and be infused together with it, so that teachers, K-12, weren't being given so many different separate resources from which to pull to create their lessons. Teachers who are working with younger groups are probably already including a lot of this stuff in their basic lessons that are just about creating a classroom environment where students feel welcome, supported, accepted, etc. But then, as we were looking through the different age groups, the idea of pulling this together with the guidance document and the other requirements, and then creating a document that essentially could work well with all of them in conjunction together, was really important to the health educators who participated in the exercise. That way, teachers didn't feel, as I said before, put upon. How am I going to work this into my curriculum? Now, this is one more thing. It really was supposed to be a resource that helped them to create something that was going to serve their students in conjunction with what they were already doing. So that was really important to us as we looked to create that guidance for them.
Yeah, and as we developed the Resource Center, we felt the same way. There's a lot of initiatives that are happening in schools they might not be directly related to mental health education, but kind of in context they were. When we think about things like trauma-informed schools and restorative practices, social emotional learning. So much of that was interrelated. And through the Resource Center, we've tried to help schools kind of unpack that and
Mm.
see how the things that they're doing support one another, each of those initiatives. On the next slide, we have a little bit more data about the utilization of the Resource Center. So we know that at this point, 75% of public schools have in some way accessed the Resource Center. Now, it may have been one particular educator, the health educator, who downloaded resources, or it might have been our staff going out providing professional development to schools. But that is a percentage that we're certainly proud of, but we know that we have a lot more work to do in terms of making sure that everybody across New York has the resources that they need. As Jess said, there's accessible lesson plans that people can just download and really just kind of get moving with, rather than having to be concerned about, do we have funding available for a large scale program? Or as Jess mentioned earlier, we found that there was a lot of health educators that were doing some really great work in this area. And so they didn't need an entirely new curriculum. They just needed to be able to understand, what were they already doing? How did it relate to the requirements of the law? Maybe what were some of those gaps, and did they have some resources, or did we have some resources that we could direct them to sort of fill in those needs? And then finally, as we said, professional development. That's been a large part of the work of the Resource Center, both in-person development and online trainings, which, and certainly when we have situations where people, as they have recently been, distance learning becomes very important. So that has been a really great resource for us. On the next slide, a little bit more data about the utilization of those resources. And the other piece is that we've had the opportunity to provide direct instruction to students as part of the health education, which I think is helpful for health educators because it sort of brings in another person to provide some of that information. But I think also there are still going to be people who aren't adults. As Michael said, we weren't taught mental health education. So there are still adults who are not 100% comfortable talking about mental health. So if we can go in and provide that instruction, and put some folks at ease, I think that's really important.
And I'm laughing as a parent because I know there are some uncomfortable topics you'll have with your kids. And to be able to, like I said, I have a background in psychology and social work. For me, the conversation is a little easier. But even I don't want to treat my kids like they're my patients. I want to be able to be a parent and to have someone else start the ball rolling, to start the conversation. So maybe my kids will seek me out, or we'll have a discussion that isn't me constantly going towards them. It can go back and forth. I think it's very, very valuable for a child's development.
Yeah, I think that's a really great point. And I also want to add, with regard to the Resource Training Center, so much of the work for this was done proactively and ahead of time. And I think that as an educator, I talked to a number of colleagues out in the field who literally, the mandate came out July 2018, and right away, where do I go? What do I do? Where can I access information? It was there, it was ready. And the work for that was, as you said, over a year and a half in the making, with those lesson plans being ready to go, with the various webinars right on there, ready to be accessed, with people looking through almost like a checklist of sorts, like you're mentioning, like, am I including this? Or, oh, should I be adding that in for those who are already including some things but wanted more? I think the website, in conjunction with the information put out from the health educators, the actual guidance document, literally gave people a chance to do almost a gap analysis of, what do I currently have in my curriculum, what are the needs that aren't yet being met, and how do I fill in the gap, essentially, to enhance my program for my students, so that yes, they can go home and hopefully approach their parents, like Michael is saying, so that it's not just constantly coming from the parents down, but rather now the kids have some background and they can come to their parents as a resource in the other direction.
Yeah, and I think, kind of reflecting on all of that, Jess, I think that if there's other states that are wondering, is this something that we can do in our state? Those are some really important pieces to keep in mind, that it really does take a collaborative effort of all interested educational stakeholders, but also our state agencies. The Office of
Mm.
Mental Health, the state education department was really involved in the advisory council, extremely supportive. And then, of course, without the support of our state legislator and our executive to be able to fund the resource center, I think it would have been a very different implementation process. So that was really key.